Hello, my name is Lindsay Shuck. Thank you for joining today's Family Office Network's webinar series featuring OXIO Health. I would like to take a minute to introduce our three speakers today. First, Noel Guillama, President of OXIO Health. Noel began his career in the family construction business and then became an angel investor in healthcare and switched his career to acquisition and management for medical practices. He designed an electronic health record and is co-inventor of 40 patents in healthcare and has taken 6 companies to public market, including 2 via IPO. Larsen is also with us today, Executive Vice President and COO. Carl has over 35 years of engineering and construction, owning as well as managing small and large startup organizations with upwards of 30 million in revenue and more than 350 employees. He has 20 years of experience building and managing software development teams and more than 11 years in the healthcare industry. Lastly, Gregg Steinberg, outside board member and vice chair. Gregg is currently the CEO of Greenway DNA, a DNA testing solutions provider. Gregg was president of an early stage company that under his watch generated 2 billion in organic revenue, grew to over 2,000 employees, and was in the top 10 of the INC 500 for 2 consecutive years. Gregg has been on the board and operating level in healthcare for over 15 years. At the end of today's presentation, we will have time for Q&A. We encourage you to send over your questions at any point during the presentation using your questions chat option on your screen. Noel, I will let you take it from here.
Thank you very much, Lindsay. Appreciate everyone's time. I was taught a long time ago that you need to have a good elevator speech. So I'm going to give you that introduction while I get the slide to move. Carl, it's not working. We bring 30 years of healthcare experience, combining physical assets, medical operations, and technology to change and transform the experience of consumers and providers with technology-infused care. As I say, and you can hold me accountable, the first $500 million is going to be easy. As we succeed, we will empower the patients, enable providers, and enhance the science of healthcare. We bring comprehensive solutions to a complex system that includes actual customer care, innovative physical locations, and end-to-end technology solutions. To investors, we bring a new model that is built to continue to create value and reward you for your investments. Literally, we've created a new platform that we call a distributive venture platform. We distribute our licensed IP as well as interest in our innovative companies. We exclusively concentrate in healthcare, primary care practices, healthcare IT, and all the range of technologies to support the actual providing of care. We're living through very interesting times, and you don't need to be a healthcare expert to realize that the healthcare industry has been dramatically impacted by what's going on. You would think it'd be exactly the opposite, but there's been a transformation that is impacting healthcare in an unprecedented way, truly a black swan event. That, however, is about to change, and that's going to change in a couple of ways. First of all, we have an exploding industry that is primarily driven by an aging population, and we believe that sort of in a COVID world, the acceleration of technology and services will be enhanced. There are fundamental things that we have to fix in healthcare. One of them, we're going to talk about it, is about structure, how doctors are paid, and how delivery is provided. And secondly, is how technology infused, really sort of technology infused care. And as I noted, that problem is actually going to get worse. This is a graph showing actual and projected Medicare spending in the United States for the next 9 years. And you can see that the number is effectively going to double from the baseline of 2018. So this is not going to go away. This industry is just going to get deeper and more complex. Now, talking about complexity, recently we all were able to witness a couple of 3 really giants that got into healthcare with the goal of dramatically changing healthcare. And that obviously, these are three people that we know very well. And we'll talk about them later. It literally was Bezos, Buffett, and the CEO of JP Morgan. Their idea, their concept, well intentioned, was that they were going to dramatically change healthcare. What we know now is that that idea has not succeeded the way they planned. And we talked about that literally after they made the announcement that the only way to truly disrupt healthcare was to aggregate the actual delivery of care, the way doctors are paid, and the use of technology. That's the only way it's going to happen. And we bring some of those solutions to the marketplace. First of all, we are going to talk in our presentation a little about structure. Is a transition from fee-for-service care to value-based care, the comprehensive care of the patient, and what we call technology-infused care. That technology literally starts with the basic of electronic healthcare record or a personal health record and is aggregated by other technologies, including IoT and wearable devices that allow us to treat the patient not only when they visit the doctor or the hospital, but literally continuously monitor and treat that patient. And the reason why that's important, not just because of egalitarian goals, but that's important because that's also the way you reduce the cost of healthcare. Now, we tell you this not from theoretics or theory or being, tangentially involved in healthcare, but actually being physically involved in healthcare, in literally operating medical centers, operating diagnostic laboratories, interacting with thousands of physician practice, and actually being involved with two medical schools. We bring a tremendous amount of experience in the physical assets of healthcare, not only building medical facilities, but operating them with deep experience in construction management and the management of medical facilities. We also bring a tremendous amount of technology to bear. That technology that literally was designing and building electronic medical records, literally participating in over 40 patents, including additional software in the area of customer relationship management and literally built-in number of legacy systems in software. So that's the kind of thing that we bring to the table. And last and not least is actually having the financial experience, having run medical practices, negotiated with the largest HMOs in the state of Florida, handled numerous reverse mergers, acquisitions, literally been involved in allocation of capital, collectively about $300 million, and literally taking companies from zero to IPO or for early stage to literally hundreds and in multiple cases, thousands of employees. So we bring a tremendous amount of experience to bear in an industry that needs those type of solutions. How we got here? We literally got here as originally it was the R&D subsidiary of what became our parent company, now our majority shareholder, that aggregated these technologies and these solutions. We changed our name formally January of this year, almost by fate to what's happening because of COVID-19. We've updated our vision to understand that we're looking at not only aggregating the doctors, integrating them, but also changing the environment for patient is given. And we see a literally $100 billion opportunity in this marketplace. So the way we're structured is literally as a parent with 5 operating companies under it that are intended to interact either with the consumer or with the providers or with other type of providers like hospital systems. And we'll talk about these companies here in a second, but they're all integral. We need to look at a holistic approach to healthcare to provide this solution. That is why, after literally hundreds of $billions that have been invested in healthcare, we have seen no material change. We have seen no improvement in the cost of care, certainly not a reduction in care. We have seen no improvement in the quality of care. And we've actually, at the ultimate, not even seen an improvement in the mortality rate. So that tells you an industry that is ready for disruptive change. So the way we look at it is a couple of different things. We look at sort of 3 problems and 3 solutions. The problem is the lack of sort of that patient-centered care, the actual delivery of care, how doctors get paid. The reason why the healthcare industry has been so materially impacted, that hospitals or doctors that were not directly treating COVID patients saw their patient numbers literally collapse. The solution is a comprehensive solution to healthcare that is patient focused, that is not based on encounter, but it literally is based on the outcomes. We think that only way that is possible after 30 years of experience is not by having separate silos of services and technology, but we literally see it as the infusion of services and technology. And that's why our model is, in our opinion, so revolutionary. So back to the technology side, we're seeing a lot of technology companies. We literally just saw a report of record investment in technology companies, and there have been a lot of EMR companies, a lot of PHR companies, and all they've created is just deeper digital silos. We went from paper silos to now digital silos. There is no that comprehensive solution. There is no universal record. And not only is that important for the patient, but it's critically important for the provider. And we think that that's the only way we are able to move forward is by that bringing in that technology as the care is given. And that's a big solution for us. We also see a tremendous opportunity in investors, in the direct investors. Is one of the problem has been investors' access to early startups, to well thought out companies, to companies have bring a lot of experience into the marketplace. Many times they have been literally scooped up by venture capital companies. And the sad part is that those companies have done incredibly well for those venture capital companies. But in fact, once the companies have gone public, they've had a very poor record. So we have literally innovated. We actually filed a trademark for our distributive venture platform. The idea is to distribute that technology, that business acumen across multiple companies. We're starting with 5, but there will be others. We're distributing a certain amount of the interest in those companies, the equity industry interest in the investors directly. And that provides a couple of real big value for investors. First of all, we believe that it enhances the value creation opportunity and also creates liquidity, as we'll talk about later, because there's a lot of ways to create liquidity once you have that kind of model. So at the end of the day, we have a tremendous opportunity. What I sort of call here, this is your Warren Buffett moment. This is an opportunity that of an industry that is literally in chaos. There's expectation that 10, 20, 25% of primary care practices may close as a result of that antiquated fee-for-service model. There is literally serious crisis in the industry that allows for an opportunity like us. Many of us probably read a couple of days ago when Warren Buffett literally went in and saw an industry in the crisis and an opportunity, and he picked up the assets that we saw of Dominion Energy for $10 billion. This is literally that kind of opportunity in healthcare. Also, we've got a lot of problems with consumers because they've delayed care, they postponed care. They're not there. There are many solutions that are available by telemedicine, but they cannot all be that way. So we have a crisis literally in this country, both from the provider side and also for the consumer side. So let me tell you about our 5 companies. One of them is literally going to provide care to patients directly. We're going to take that opportunity, that Warren Buffett moment, and acquire practices, consolidate them into much more efficient and effective operations, something we have done time after time. And we see tremendous opportunity in what is the pay for performance away from that fee for service environment. And as you saw, the growth in Medicare, one of the biggest components of Medicare growth is actually Medicare Advantage, which is where consumers join insurance companies and are provided care by patients. I've done this over and over again. That number is going to continue to grow because we're seeing new entrants into the Medicare system at a rate of 10,000 per day. So what does that bring us? Is that bring us annual recurring revenue, $8,000 to $10,000, depending on what market we're seeing. I am confident that we will be able to increase these these acquisition revenue by over 200% over 4 years. And we're going to bring in a suite of products and services that we already have literally in our wheelhouse. And that is the technology, the EMR, the IoT devices. And this is something that we have done before, literally taken a company from zero to $100 million in exactly 4 years. So that's an opportunity. We also know that as we acquire these practices, keeping them in the current environment is inefficient and ineffective. And what we have done before, literally time after time again, is we've aggregated these practices. But there's another Warren Buffett moment, and it has to do with real estate. So what we intend to do, what we will do, we have the experience and knowledge and the background, is we're going to acquire the right type of real estate in the right location. We're going to convert them to state-of-the-art medical offices and medical delivery system. And the picture that you're seeing here is literally abandoned real estate within 10 miles of our literal office today that we would be aggregating and consolidating our practices there. We will be providing the technology and the solutions. So we think it's a tremendous opportunity. They obviously will be the latest technology, and we will be able to attract doctors as they come out of medical school that do not want to practice in a large group environment, that do not want to practice in a hospital environment. We'll be able to offer them opportunity to literally sublease space in our facilities. It is an incredible opportunity both for physicians that are looking to retire or partially retire out of healthcare, and physicians that are entering the marketplace. So at the core of our product is going to be our nervous system, which is what we call power. We literally were, the company license was was just approved. So we now have a patented platform that has been built, has been tested, and we're literally at the beginning stages of building a communication platform to take it to the next level. This is super important because that communication is critical. Almost every other company that we're aware of, certainly over 99% of the companies out there, are using third-party vendors, and that creates a tremendous roadblock when you want to advance the delivery of healthcare. You're literally having to depend on a third party to do it. We're changing that. We're also going to be using that same knowledge and information and creating a unique platform where the consumer literally controls their own medical record and is able to use that medical record both for themselves and be able to share that. Literally, there's a patent pending on this platform, and we think it will change the control of the medical record from what has been the healthcare industry to the consumer. And last and not least is actually another patent that we just got were approved, which is literally the aggregation of the multiple devices. We do not want to build the devices. We don't want to build the devices that are going to allow us to do that distant care to the patients. We want to grab that data and aggregate the data and see it both in the EMR and in an actionable way. We talk about it sometimes almost as the way air traffic controllers are getting data. This patent was literally just approved a few weeks ago. So this is going to be information that we're gathering from the patient, that we're processing, we're using data analytics, certainly machine learning, and eventually bringing it into the medical record if it needs to be stored or if it needs to be alerted to the doctors. I don't think, again, we're making a huge leap that everybody knows that IoT connected devices have been growing at an exponential rate. We personally think that with COVID and now with the introduction of 5G, all the expectations for IoT devices are going to be short because we think the opportunity is that much bigger. So the reason we're here is we're in the process of raising about $7.5 billion in a convertible bridge note. The bridge note is designed long term to be sort of at the maximum a 2-year conversion, but I can tell you as CEO, my goal is to go to the next round of financing immediately as we go in and work on the process of acquiring the real estate, acquiring the practices, and my goal is to have this converted before the end of the year. The use of funds are here. It literally is to get, as a friend of mine likes to say, is to get this plane on the runway and moving forward. So we're going to hire the team that we've already identified. They're all industry expert, technology experts, and allow us to really move forward. Our projections are in some cases very aggressive, in other cases they're not. I will say how we started this presentation. The first 500 million is going to be the easy part. And what we bring to the table, as we said before, and Lindsay described, is a very experienced management team. And I will tell you this, regardless of what you think about us, is that healthcare is an industry for experts that understand what it works. It is literally the hardest industry to get into. It is the hardest industry to make an impact. The sales cycle in some cases is years. So when you bring in 10, 15, 30 years of experience, we are automatically one leg ahead of everyone else. So with that, I'd like to leave it up for any questions that any of you may have. I'd like to open up the mic, please.
Thank you, Noel. Again, everyone, yes, we encourage questions. We have the team here and ready to answer anything that you might want to ask. There's a questions chat option on your screen, so just chat over the questions. We will answer them accordingly.
Wonderful, thank you, Lindsay. So I'll moderate the questions, and as they come in, try and direct them. So first question, Carl, maybe you can pick this one up. This seems very complex. Why not just one of these companies?
Well, I think that's an excellent question because it gets to the heart of our OXIO, what we call our ecosystem model. Healthcare is a very complex industry, as Noel has already stated, and it's very highly regulated. But I want to take a look for a moment at another industry, if we can, that is also very highly regulated, and its business model is also complex, at least if you consider ours to be. And that's FedEx. We're all familiar with it. Most people look at FedEx and think of a company that takes a package from point A to point B, but it is a very, very complex operation, probably the largest package and freight delivery company in the world, operating in 220 nations and under all manner of laws, whether it's aviation or ground transportation or warehousing and delivery. The laws and the regulations are significant. So they have, as you can see, 4 relatively independent, but of course they have to be integrated operating companies. They have a Part 125, that's a cargo airline that does air freight all over the world. They have a good friend of mine was senior captain with them. They have a package delivery. We've all seen the little FedEx trucks running around doing the deliveries, bringing packages to your door and picking up from your door as well. They also have a nationwide palleted carrier service, trucking company, and they have a warehouse and distribution where they literally do their sort and organize for delivery in a number of locations. Memphis, Tennessee is their main hub, and they at one point Memphis was and may still be the busiest airport in the world, largely because of FedEx. So you can see that FedEx also has what I would call 4 non-consumer facing companies. They have a marketing and communications company, operations and services support, sales, HR, and staff. The other thing I'd like to point out, and you'll notice this up in the top right, and that is that FedEx Corporation holds 112 patents issued to them, everything from warehouse management, the software management, the pick and place software, to package handling and tracking, and much more. So if we see this model and note the large investment they have in aircraft and vehicles and package handling, I want to take a slide over here and go back to our organization. So you can see we've got 5 independent portfolio companies across the bottom. Yet, as Noel has already said, they're highly integrated. We also have 3 I will call captive companies or non-consumer facing that will deal with construction services to do the build out of the care works as well as tenant improvement in our corporate offices and other locations. Our health, the OXIO Health Administrative Services, that is HR and legal and finance, payroll, and then technology services that will be building the healthcare IT and power, PWBR, Blue Box, and handling the build out of that in CareWorks and Total Care. So we have also what some people think is complex. I find it to be very interesting because everything is interwoven and cross-supported and backed by 21 licensed patents and 18 patents that are pending. So we have a very well-designed ecosystem that is created to address the complex issues in healthcare. Not a single bullet by any means, because single bullets will not work to solve healthcare. Greg?
Thank you, Carl. Question relative to utilization of some of these technologies. How do you get clinics to use these new technologies? Is there an incentive mechanism to change their behavior?
I'll take that. I've operated literally dozens of clinics, and the biggest incentive is a direction. What we're going to do is, as we have done in the past, we're going to acquire medical practices. We're going to go in there and help them solve their problems. We're going to handle everything from their HR problems to the copiers to the technology. So one of the things that technology companies have a problem with is they don't have service providers they can control. And one of the biggest problems that service providers have is they don't have technology. So I can guarantee you 100% adoption of our technology because it's going to be integrated. It's like telling someone that they're going to pick the furniture they're going to have, or they're going to pick the color of the office they're going to have. These offices are going to be branded with the Total Care brand. The technology that's going to be used is going to be provided by us. We were literally going to provide the tools. So I guarantee you, with the proper training that and the proper lead time, that within 2 years, we will have every one of our doctor practices using our technology, because that's the only way you can make it work. That is a challenge that we have in technology that I tried to say at the beginning. We have had two silos for the last, literally 30 years that I've been into it. You can go back even further, where you had technology companies providing solutions, or at least what they thought were solutions, to the medical team. And you had technical teams that was looking for solutions that technology companies are not providing. And what you did is you end up having a workaround. You started moving change. That has to change today. Okay. Just like, the example that Carr used of Federal Express, you have the people in Federal Express do not get to pick what airline their packages goes on. It's going to go on a Federal Express. So that's a scenario that needs to happen. So I guarantee you that our technology will not only be used, but when it is used, it'll provide better care to patients at a lower cost.
Thank you, Noel. Next question coming from Vikram is relative to competition. Don't quite understand your technology edge. EMRs are common out there. What's your competitive edge?
Well, let's go to competition. We have a slide that we had just in case that question came up. And we're not an EMR company. We started this company, this organization, as an EMR company. We realized that we were not solving a problem because doctors did not have the time, the energy, or the training to use a EMR. So if you look at us only as an EMR company, then we're not for you. We're looking at all of the solutions, okay? And right now, EMR is just a component. It literally is a nervous system. Think about it as the electrical system of a car. That's the way it has to be looked at. So if we're not going to go out there and literally only compete on the EMR platform, we're going to compete on providing services to doctors with our own EMR. It is proprietary. We designed it, as you saw in the presentation, it's a patent. So even though we've got competition in the EMR space, we're looking at it different, because I can tell you this for a fact: eClinicalWorks, Athena, Epic, CareCloud, Modernizing Medicine, McKesson, and Cerner, that I know, none of them have a captive healthcare delivery system. They're looking at delivery system as a customer. We're looking at EMR in our platform as fundamental to our providing care. So I would argue we're not an EMR company. We just happen to have an EMR solution, just like in an example that Greg, again, and Carl put, we happen to have, I don't know, was it 600 airplanes? Eventually, we have zero doubt that our EMR solution will be adopted by other market players that are looking at a solution that's market-based for care management and for value-based care. Every one of these companies was founded on the idea of billing and collections, because you can go back to them where their revenues are. Athena's revenue, CareCloud, Modernizing Medicine, great companies. They were designed to be revenue generation, not designed around exclusively the managed care and the care management components.
Thank you, Noel. Question relative from Stan, relative to integrating these different components that we have underneath these 5 companies. How do you integrate with existing healthcare delivery ecosystems and eventually migrate to your blockchain-based platform? What's your go-to-market plan and timing?
Well, the great thing is that right now, all of the EHRs, for example, have to have a communication module that allows them to exchange data. The government has created a mandate by 2021 that all of these systems are going to have simpler communications. We'll see when that happens, but we will certainly be on the leading edge and cutting edge of that platform. And again, what we will be able to prove to potential customers of our EMR in the future is not that it's interoperable and it connects to the hospital-based system, which in this case would be the Cerners, the McKesson. I think we're missing Meditech, and Epic is there. That's not magic. That's just literally coding. What is magic is when you're aggregating the multiple informations from other providers, because at the end of the day, all hospital-based system is acute care, and that is extreme care that tells you some history. But what you want is literally the day-to-day interaction of that patient. And that's why we think that the integration of the IoT devices in distant care is going to be very valuable. Where it also becomes valuable is when you take that data, and by the way, we will be the biggest users of that interoperability, and you deliver it to the consumer, and the consumers now can be able to use that data for themselves, when they travel. And we think it's going to be a game changer when you're trying to do research, literally pharmaceutical research, university research, even to health departments, what is going on in the community at large. We think that kind of data can be put securely on a blockchain controlled by the patient. So we're the biggest advocates of integration, and that's why we designed this model that no one out there has designed. Understanding how healthcare is delivered, how doctors work and how they function, and also how the technology can be used to really be a change agent for the next decade.
Great. Thank you, Noel. Carl, a question maybe you could address relative to telemedicine. There's a lot of talk about telemedicine today and changing environments. How does telemed play into your portfolio?
Sure. Telemedicine is a very, very important component. It certainly has gotten a lot of press as a result of the pandemic due to the quarantine and everything else. And it is a very important component, and it's one that we are working on right now with our senior system architect. We have plans in place to have a telemedicine module stood up within Power by the end of the year. So more than that, however, telemedicine is and as I said, it's an important element, and it's integrated into a total picture, not just an individual picture of the total offering that we have. You know, what we've got is a telemedicine module or a telemedicine room, if you will, within CareWork, where a physician can go in and get on with a specialist or another physician to do a consult, or a patient can go in and do a consult. We're looking at providing through Total Care packages of wearable devices to those Medicare Advantage patients so that our care managers can keep track of the patient even better and reduce the cost of their health care while increasing the quality of their wellness. So what telemedicine represents for us is yet another facet of what we're doing to move toward where we feel and the market seems to be directing remote patient care is a very important element. But telemedicine, let's keep this in mind, as a single element is not as valuable as it is when you add active remote monitoring and the electronic health record or the electronic medical record. With those two components added to telemedicine, the doctor has in hand the information that they need. How could a doctor ever answer a question from a patient that says, I've got a headache or I've got chest pain? They don't have the electronic medical record available. They don't have the vital signs, blood pressure and heart rate as a minimum. There's no way they can do an accurate diagnosis. All they can say is go to the emergency room, and that's not quality patient care. So it becomes one element. It is an important element, and we're building it into, not building around it.
And a follow-up to that, which goes to the Internet of Things, the wearables, talking about Blue Box, right? So
Sure.
How does that play into the telemed piece?
Well, again, as I was saying, the telemedicine really requires the electronic health record program and active remote monitoring. A physician on a telemedicine call really needs to have those vital signs and other physiological metrics that allow them to actually do a good diagnosis. They need to know what meds the patient is on. Even if they know that patient and have had a relationship with that patient for years, it is behooving of them to have that data and that information available. So our Blue Box Internet of Things brings that wearable technology capability and data to the physician. Also, as I mentioned in Total Care, it is a very important element in ensuring that our case managers are able to better survey and keep track of the patients that have been assigned to them, the Medicare Advantage patients, and reduce any costs, such as a visit to the ER that's very expensive, and be able to manage that patient in a much better and lower cost way. That increases revenue for Total Care, increases the patient's quality of life, and is a win-win all the way around.
Right. Thank you, Carl. Noel, a question coming back to you. As a potential investor, what am I invested in? The convertible note in the holding company, ? Or is my investment through the convertible note invested into equal amounts into the portfolio companies? Can you clarify?
That's a great question. Right now, the convertible note is basically invested in the parent company and will be converted into the final. Sorry, let me see if I get this. Into the final offering that, as I said before, I want to get done before the end of the year, but it's designed to be no more than 2 years. And we think we're negotiating right now, but we think that what will happen is that in that final offering, that convertible note will not only get converted into one of multiple instrument in the parent, but there may also be a distribution from those 5 companies we have today. What I can assure you, whether we do it that way or not at this first sort of the A round, is that in the future, if you remember those slides that we showed you, Carl, can you give me the diagram slide of all the companies? This is why we call the company a DVP, is as we create new companies, which is what we've done in the past, we will distribute certain number of those shares to our investors. That is the novelty of the DVP platform, so that we sort of look like a venture capital operation. So when you see under Total Care and CareWorks their future, we've already got that company right now, literally in design and contract stage. Is once we put that company literally here formally, then we will distribute, as we have with the other ones, a certain percentage of those companies directly to our investors as founding investors without having to put up any capital, no capital call or anything else. And that is a uniqueness. So let's go back to the slide number 33, Carl, please. So if you go back to slide number 33, we had a little technical issue. It will tell you the opportunities for us is in monetizing right there. In monetizing your investment is many ways. One is we could spin off these companies at the right time and place into a separate, fully independent company. And I certainly have an affinity for IPOs. Second is the companies could be acquired by a third party that's looking to aggregate, for example, their delivery system. I can tell you that because the company that I founded was eventually acquired by its only contractor, which is one of the largest healthcare delivery or healthcare management companies in the United States. So that's a very simple opportunity that's going to happen. And right now, United Healthcare, Humana, and even some of the Blue Cross and Blue Shield networks have extensive doctor delivery systems. So that's an opportunity for us to sell one of our companies. Also, there is a tremendous opportunity for venture capital and private equity that are looking to augment their existing portfolio company with our technology or our resources. Certainly an opportunity is something very fashionable today, is either the whole company or some of these companies could be put into a special purpose acquisition company, normally known as a SPAC. I will tell you that my favorite and what I like the most, and I'll tell you why, is another IPO. And the reason for that is that also provides a tremendous incentive for doctors and encourages their retention. So when we acquire practices, I've done this over 60 times, is you acquire a practice optimally for a certain component of cash, a certain component of what's normally called an earnout of 1, 2, 3 years to basically assures the doctor's not going to retire on us. By the way, I've lived through that also. And last but not least is a very material component that's based on equity and equity upside. So the only way that really becomes tangible and real if the company is either on its path to an IPO, which has worked very well for me, or has just completed an IPO, or the company's already public. So I think I answered 2 questions with that, Greg. Thank you.
No worries. That's great. Thank you, Noel. Carl, for this next question, could you put up the slide that's got the revenue breakout amongst the 5 portfolio companies? Noel, the question is, how do you generate revenue? Do you charge annual fees to doctors who use your whole suite of products? What about the clinics, the healthcare centers, et cetera?
Okay, so that's a great question and my favorite question. So that's it. You can label that one. So the fastest growing part of this company, without any question or doubt, is going to be the healthcare delivery, because we're literally going to acquire doctors that already have revenue, already have operations. The average doctor that we're going to be acquiring is going to be probably generating about $500,000 in revenue today. Well, let's call it pre-COVID. Post-COVID, probably the number's about 50%. It's got a modest bottom line, so we're going to be acquiring it for either our expectation of a sort of return to normal revenue or based on their number count. So without question, the leader by revenue is going to be our healthcare delivery. So every time we acquire a doctor, we acquire 20 doctors, we'll have $10 million in revenue. And as I said, we're going to increase that revenue by, I assure you, 200% over 4 years. The second biggest component of the company is going to be the real estate. Let's go back to that doctor that we acquired. That typical doctor we're acquiring doing $500,000 in revenue, by the way, has about 2.7 employees per doctor. Some doctors have more, not many have less, is going to be paying rent. So if he is occupying, the average doctor has about 2,000 square feet, they're going to be paying, probably somewhere in the range of $3 to $4, $5, $6,000 a month for their space. What we're going to do is aggregate those doctors, 2, 3, 4, 5, 6, probably 6 or 7 would be the peak, into one of our locations. So we're going to bring that expense that they were having, which now is a practice owned by us, onto our real estate, and the real estate that we converted. We also are going to open up about 50% plus or minus of that real estate for other physicians that want to have a satellite office, or frankly want to have that as their full-time office, and they want to sort of, let's call it feed off our order flow. We're going to have literally hundreds of patients coming into our practices, and those doctors that we're not going to provide the services, we're going to concentrate on the primary care services. That literally is family practice, internal medicine, OBGYN, probably cardiology. Those are the focus. But so if you have a neurologist that is looking to expand into a satellite office, we would be a great location for us, because we're going to provide them not only with technology solution, the staffing solution, but we're going to give them an opportunity with real live patients. So number 2 is going to be the real estate, without any question whatsoever. The rest are really the technology platforms, with both including the EHR and the IoT company, or we call it Blue Box, that are going to be both facing consumers and facing providers. And last and not least is the blockchain, which we think could have literally sort of blue sky type of opportunity, or moonshot opportunity, by the aggregation of data and the analytics of data. So that's sort of the way it works. And we have zero doubt about the mechanics. So it's not a membership model, though it looks like one, because the HMOs, and it's another conversation we can have, are going to be literally paying us between, the lowest is probably going to be $600 per member per month. The highest, let's say, off the curve, probably around $1,800 per member per month. So to someone who does not understand healthcare, it looks like a membership model, but we're not sort of a concierge platform where the customers are paying this out of pocket. This membership model, if you want to brand it that way, is actually coming from the largest HMOs in the Medicare Advantage and Medicaid managed care business, which you could take it to the bank. We will receive our revenue from the HMOs by the 5th of the month. So this is not about billing and waiting 2 weeks or 3 months to get paid. We literally will be giving a census of how many members we have in their model by different HMOs, and they will be cutting us a check by the 5th of the month. That may be too much information or too little, Greg.
As a follow-up to that question, which is piggybacking on what you were just saying, is how would a Medicare for All future healthcare system affect your business model?
The federal government, except for the Veterans Administration, does not own and operate medical centers and medical facilities. They literally are using both nonprofit, for-profit, but certainly independent care providers, literally at the hospital level, at the clinic level, at the diagnostic level. So in our model, we could be a tremendous boost for us if the government were to say, we're not going to provide Medicare for all or Medicare buy-in for consumers. Because at the end of the day, the government's still going to go back to the insurance companies. And the top 10, the top 20 insurance companies are actually the one that provide the care. The government does not provide the care. And the government's not going to go back for fee-for-service medicine, which, by the way, we'd be happy to do, because that's going to give them no ceiling and literally becomes a forever. One of the things that the government has been trying to push, by the way, regardless of who is leading the country, is to go much more to managed care environment, which become much more predictive. So as of today, about 1 in 3 Medicare beneficiaries in managed care. We will be providing care to Medicare beneficiaries, whether it's fee-for-service or managed care. The numbers are dramatically different. We will be providing care also to Medicaid beneficiaries. In our home state of Florida, the entire Medicaid system is a managed care platform. There is no fee-for-service. It's all provided through insurance companies and their delivery networks. In other states, it's a hybrid. So Medicare for all in our current model would be a beneficiary to our business model.
Thank you, Noel. Another question, maybe you could take it also, Noel, is why is this unique? Why hasn't it been done before?
Well, it would go back to the example that we use with Amazon, J.P. Morgan Chase, and Berkshire Hathaway, and the issue is everyone's been looking at the problems in healthcare in silos. The silos have moved around. Let's be realistic, but they're looking at it moving around. I can tell you this: even though the first EHR in the United States was conceived of and developed by a hospital, okay, that was Massachusetts General Hospital, eventually became the I think it's MUMPS operating system. No hospital today that I'm aware of actually has their own EHR platform because they've gone and outsourced it to Epic, Cerner, Meditech. Very few, I only know of one, maybe two medical facilities that actually developed their own EHR, and they literally have gone through outsourcing of the technology. So what happens, and by the way, I have been to Silicon Valley many times, and I've consulted with dozens of startups in healthcare technology. And my questions are, who is the payer? Who is going to pay for this product? If you think the doctor's going to pay for this product, you lost your mind. If you think the hospital is going to pay this product, and you're not, literally one of the huge medical device manufacturers, you probably are going to lose your mind in the process. And the insurance companies, forget it. They don't invest in technology. They invest in delivery system. So what is unique about our model, and no one has done it, is we bring all of these components into the same delivery platform. And we have the experience, the credentials, the credibility to say we understand managed care because we were there practically at the infancy, certainly into the early 1990s. We understand EHR and the use of technology, not only with, literally the almost, over 20 patents that we have been issued, but having built and operated an EHR platform. We understand the real estate component of it. Back to the example that Greg put of Federal Express. The reason why it hasn't been done, it's really, really hard. And you could not do this without having 20, 30 years of experience in the industry that says, here are the problems, this is how we solve it. That's why it hasn't been done, Greg.
Perfect, thank you. Maybe time for one more question and some closing thoughts. Question is, with COVID-19, how has it impacted your business model?
Well, as we said in the beginning, this company was already on its way. We've been working on building it for a long time. We literally changed the name of the company in January, right at COVID. It is not my intention to say that COVID has played into our strong hand cavalierly, but it has. The fee-for-service model is broken. Everyone can see it. Everyone can witness. Literally, there were almost 2 million healthcare employees or people that were laid off at the beginning of this cycle. Let me tell you something. In 30 years, that has never, ever happened. Right through the recession of 2008, 2009, healthcare employment not only did not drop, it continued to increase. This has changed. We also realize that we need to connect with the consumer on a real-time basis. So now how do we provide care? Well, the short-term solution is telemedicine. The reality is when I talk to doctors, and I've been around doctors for now 31 years, there is only an incremental value in having a visual communication with a patient versus a phone communication. The doctor literally told me yesterday that 80% of what he needs, the patient can tell him over the phone. The rest of it has to do with their demeanor, their color, and can you really trust the color? What we need then is we need to aggregate the IoT devices. That's why it is fundamental to our strategy, the patient's electronic medical record and the healthcare delivery. I literally operated one of the largest mobile diagnostic companies in Florida. That's also part of this. We literally have to bring care to the consumer. So COVID has literally given us tremendous opportunity both to deliver the product, but as I said, in sort of what I'm going to sort of coin the Warren Buffett moment, there is no better time to be acquiring physician practices than it is today because they're in desperate needs of solution. We're giving them a lifeline with a real exit strategy. One doctor says you're creating the shelter in the storm. The second part is fundamental to our original strategy. We didn't create this company last week or last month or even last year. Is understand, having built many medical centers, is where you give the care is fundamentally important. If we're going to take 7 doctors, okay, and we're going to take 21 employees that they may have, or 30 employees, and we're going to create a much more efficient system by either providing better quality and reduce costs and better outcomes, we need to control the physical real estate. I cannot tell you, as a sort of recovering or reformed general contractor, how many times I went in and gutted a medical offices because it did not work. The patient flow was not optimum for the delivery of care. So we have to control the component. Back to Carl's perfect example of Federal Express. If you're going to control the product, you have to control the receipt of the product, the transportation of the product, literally the exchange of the product and the delivery of the product. So we didn't design this company about Federal Express, but we've been asked that question before, and all of those are complex answers. FedEx could have done many other things to try to achieve their business model, but they realized they had to control it. So I can tell you this, the only way healthcare is going to be dramatically changed is by not having a technology company on one side and a service provider on the other, and maybe some interaction. You have to blur the lines. You have to put them together so it is one team, one vision, even in all of the execution of services and technology.
Thank you, Noel. So we have a minute or so left. So I would thank everybody for joining us for this last hour. And we invite you to join us on the journey. We're happy to reach out to each one of you as we work to empower the patient, enable the doctor, and advance science. And Noel will give you the last word and then hand it back to Lindsay.
Well, I just want to thank you. I think you ended it well. Thank you very much for your time. Thank you for your patience. Hopefully my voice was not too horrible. And thank you, Lindsay.
Fantastic, gentlemen. Thank you so much. On behalf of everyone at Family Office Networks, to all of our attendees, thank you so much for joining us. We will be following up with you all individually, so if there are any other questions that you would like addressed, we can do so then. We hope you have a fantastic day, and we look forward to speaking with you soon. Thank you.